Hi, I am Dr. Hema. I'm a consultant cardiologist at DRM Hospital Mysore. I'd like to wish all of you a very happy International Women's Day. And I feel the need of the hour is to empower women with regards to their own health and especially cardiovascular health. It's alarming to note that women's heart disease in India is 3% higher than the global burden. But on a silver lining, most of these factors that lead to a heart attack are modifiable. What are these risk factors? Number 1, hypertension. Number 2, abnormal cholesterol. Number 3, diabetes. In all these conditions, it's important that you consult with your doctors and know your numbers. So knowing your numbers, taking your medicines regularly, and regular consultations with your physician is extremely important. Coming to the other risk factors, these are easily modifiable by yourself. That is your diet, your activity, smoking, alcohol, and also stress levels. So coming to your diet, you have to eat a wholesome diet with whole grains, vegetables and fruits, avoid trans fats and excessive sugars. Coming to exercise, at least exercise 30 to 60 minutes a day, at least 5 times a week with moderately intensive workouts. Coming to smoking, if you don't smoke, don't start. And if you're not an active smoker, don't be a passive smoker either. Both active and passive smoking can lead to increased risk for heart disease. Tobacco in any form is an important risk factor. Then coming to alcohol, try to limit your alcohol intake to less than a glass a day. The other modifiable risk factors, namely stress, is very important to be moderate and to be reduced. Because in women in particular, we are seeing a lot of cases with stress cardiomyopathy, excessive stress causing a heart attack like feature. The other risk factors include a family history of heart attacks. Do you have a first degree relative who is a man and who was less than 55 years old when he had a heart attack, or a woman less than 65 years old when she had a heart attack? That can give considerable risk for you to have a heart attack in future. Coming to women in particular, when it comes to menopause, women again develop the same risk factors that men have at that age to develop a heart attack. So when you are approaching menopause and when you have reached menopause, you have to be aggressive in modifying your risk factors. In pregnancy, women who have uncontrolled diabetes and uncontrolled hypertension can also develop these things later on in their life, which again lead to a higher risk for heart disease. Some inflammatory conditions like rheumatoid arthritis, both in men and women, can cause heart disease later on. So knowing all your risk factors, knowing your numbers can definitely empower you to decrease heart attacks in future and make you a more empowered woman. Thank you.